I am Dr. Janice Williams, and this lecture will cover topics related to health promotion. The slides you will be reviewing are slides that have been adapted from the company FS David. So, what are the objectives? What can you expect from this lecture? In this lecture, I will define and explain concepts related to health and health promotion. And we will discuss some of the diverse factors imperative for health promotion. Let's start by talking about what is the goal of the healthcare provider regarding health of their patients. The healthcare provider's goal is to promote health and prevent disease. So how do we do that? How do we promote health in our patients and prevent disease? Before we get into the specifics, let's talk about first, what is the definition of health? What does it mean to be healthy? According to many, the definition means the absence of disease. That is the evolution of the definition for health, the absence of disease. This view and this definition does not consider that there are other important human characteristics such as the physical, social, spiritual, cultural, and emotion dimensions that impact health. It was in 1948 that the World Health Organization defined health as a state of complete physical, mental, and social well-being. This definition does not recognize the spiritual and the cultural dimensions of a person. Health is therefore a state in which the physical, psychological, social, spiritual, and cultural attributes of a person are in balance. It creates a harmony within the body. A balance of these dimensions is an important parameter when considering health. Patients may be physically healthy, but they may be spiritually, culturally, socially, psychologically having an imbalance. And therefore, if the patient has any imbalances in any one of these factors, then they are not experiencing their optimal health. It is therefore these areas that the advanced practice nurse wants to focus on to help their patients, to help an individual obtain health to the best of that individual's ability and capabilities. So what we're looking at is a provider who, when they are assessing their patient, they look not only at the patient, but they look at all of these other factors that were mentioned earlier to help enhance the health of that individual. So let's talk a little bit more about health promotion. We've already defined what health promotion is. It's important to think about what activities and what preventative measures can be taken to help contribute to the optimal health of your patient. Recognizing that it takes a commitment from the patient, the healthcare provider, and their community in order to achieve the goal of health and well-being. So how do we start? How do we begin this process? What efforts should we be taking to seek health promotion for our patients? I would like to say these efforts, as far as the advanced practice clinician goes, it begins with us, the clinician. Then we should be proceeding with a consultation between not only the patient, but also influential members of the community. And once we've had that collaboration with them, we then think about how can the patient commit to helping their own health? What things within their life, what things in their community, what things can help to sustain the health of your patient? All of these aspects should be considered when we think about the efforts necessary for health promotion. Let's spend a few minutes talking about the levels of prevention as it relates to health promotion. There are 3 levels of prevention: primary prevention, secondary prevention, and tertiary prevention. Primary prevention is that prevention of disease. The individual never has the disease. Secondary prevention is where you do early screening and you try to detect if there's disease present. Tertiary prevention is the restoration of health after illness or disease has occurred. So remember, there are three levels of prevention: primary, secondary, and tertiary. So let's take a walk through our healthcare system over the last few centuries, or let's look at the 20th century. What happened in the first half of the 20th century? This is where the care that we provided as clinicians usually was focused on a patient who was already ill. It was the belief at a time that the patient should seek health care when they were ill, not a focus on prevention. However, in the second half of the 20th century is where we saw the advancements of technology, even got better diagnostic tests. We then shifted from a focus on seeking care when you're ill to health care to secondary prevention. Let's talk a little bit deeper about that first half of the 20th century. Healthcare practitioners cared for patients at the tertiary level. Remember, this is the level where the patients are ill and you're trying to restore them back. This is where you're trying to help patients recover from whatever illness or disease they had. And this is where you're treating that illness or that disease and you're trying to restore them to health. In the second half of the 20th century is where we focused on the second level of prevention. We encourage early detection. We encourage the screening, the at-risk patients. We looked at treatment that could be initiated and instituted before there was signs and symptoms of illness. And the goal during the second half of the 20th century was to maintain normal limits and minimize the development of catastrophic complications such as stroke or myocardial infarction for patients such as individuals who may have had high blood pressure or diabetes. So let's talk about what this looks like. In determining whether or not to screen, the healthcare providers need to keep in mind the signs of chronic disease that surface in certain stages of an individual's life. So think of an individual who may be about 40 to 65 years old. That's normally where we start to look. What are some of those chronic diseases that may occur? And what does screening look like for that? We know that the earlier we identify a risk for a disease, the easier it is to treat that disease. We also know that individuals in their midlife, they tend to focus more on the behaviors to extend their life and prevent disability than those who are younger. So it is important, as we see now in healthcare, to also look at prevention for our young adults, those individuals between the ages of 20 and 40 years old. Despite individuals of that age range normally focusing more on their relationships, their family, their images, or their career development. But what we want to do is allow and start to think about how the younger individual, how they can take care of themselves so that when they do get to that 40 to 65 years of age, that they don't have some of the diseases or risk of catching those diseases that they would have when they were younger. We also know that individuals by the age of 65, they spend more time responding to and coping with their illnesses. And as a result of that, the life expectancy increases and older adults anticipate living longer with more attention and being focused on their health enhancement if they begin to consider what things they need to do to reduce their risk of contracting a disease and promoting health and wellness. So let's talk about the levels of prevention. I want you to think about the levels of prevention as level one, when you think about just the individual. That's when you have the patient in your room, in your office, and you are talking to them about what they can do to promote health and wellness. Level two is when you think about the family. And then level three, the community. We're going to go into a little more details related to that. So when you're thinking about the individual level, that's when you're educating your patient. You're identifying their risk factors, and you're trying to prevent the onset of disease within that individual. When you think about the family level or the group level, that's when you provide support and reinforcement for the patient during the early phases of risk reduction. You educate the individual family members regarding their own risk for that disease. It's also the stage and level where the family members may be the advocates for your patient and where they are able to synthesize the information and provide support to the patient that will allow them to live a healthier and a healthy life and make the changes necessary to promote wellness. When we think about that third level, the larger group, the community, this is where you think of how do you develop interventions that can assist with promoting health within a community or a group of individuals. Examples of this is educational programs, educational groups, activities for the community that promote health and wellness. We know that if we promote health and wellness within a community, then we can touch a broader range of individuals and it can have a significant impact on the community at large and the population at large. Let's transition to talk a little bit about early assessment and management. Expanding our knowledge, we have recognized and become aware that many diseases today can be minimized or potentially avoided with early assessment and management. The development and implementation of community-wide education screening programs that will help to identify high-risk patients. An example of that is even when you see communities reach out during like church events or when you have community health fairs that will help identify patients at risk and maybe even early diagnosis. We also have clinicians when they take leadership positions within the community. Individuals and clinicians who practice in their community and get involved in the community can have an impact on improving the health and wellness and promoting health and wellness within that environment. Again, early identification, increased education can lead to improved, healthier lifestyles. So let's talk about risk factors in health promotion. When you think about risk factors, they are essential to health promotion. Risk factors can be modifiable or non-modifiable. Modifiable risk factors include things such as someone's weight, their diet, their social habits, their lifestyle choices, whereas non-modifiable risk factors, genetics, family history, age, sex, and gender. And we want to be screening our patients for potential risk factors, both those that are modifiable and non-modifiable, and making and collaborating with the patient to develop a plan or even educate the patient in ways to reduce those risk factors that can be reduced. And then what are the options for patients who have some of those non-modifiable risk factors? So now that we've talked about health promotion, what is health promotion? The clinician's role in health promotion, the diverse levels of health promotion, And we talked about the types of prevention that occur. Let's spend a little time kind of doing a case study. So, for example, we have a 38-year-old Mr. Hart. He has a past medical history negative for any diseases, surgeries, or illnesses. His social history includes the use of alcohol and cigarettes. He works an average of 60 hours per week as an emergency medical technician and does not exercise. His family history reveals that his father, paternal uncle, and grandfather all had a myocardial infarction before the age of 50. Mr. Hart's physical exam reveals the following. His height is 69 inches, his weight is 230 pounds, his body mass index is 34. Mr. Hart's labs results include a cholesterol of 250, his HDLs, his high density lipoproteins, is 30, and his low density lipoproteins is 160. So let's talk about some of the modifiable and non-modifiable risk factors that you see with our patient, Mr. Hart. He may not be able to change his age, his sex, his family history, but there are some things that he can change. With improvements in his diet, his regular exercise, his stress reduction, moderation in his alcohol intake, and smoking cessation, he could possibly reduce his risk of heart disease. It is a very good chance that changing those habits will reduce Mr. Hart's risk for heart disease. So therefore, this case illustrates the importance of early identification for risk factors. I'd like you to stop this lecture for a minute and think. You are the clinician taking care of Mr. Hart. How would you conversate? How would you educate? How would you collaborate with Mr. Hart and inform him of his risk factors and suggest some strategies that can help reduce his risk factors for heart disease? Now that you've done that, let's kind of talk a little bit about influences on health promotion. There are initiatives that occur all throughout the United States and abroad on trying to promote health. Initiatives set by the government, there are community programs. We can also see within the media, you'll see commercials, you'll see different type of educational programs that try to improve the health literacy of the communities and promote health and prevent disease. You as a clinician can utilize some of these resources to further educate your patients. If you know of any initiatives that are focused specifically on the needs of your patient, any community programs, as an advanced practice clinician, being familiar with the resources in the community in which you practice will benefit your patients tremendously. Let's spend a little bit of time talking about epidemiology. Epidemiology is essential for you as a clinician to monitor the trends in health and disease that may affect your patients. You, as a clinician, will gather and contribute to the raw epidemiological data in various health organizations. How do you do that as a clinician? When you are running diagnostics on your patients, there are certain diagnostics, certain labs that are reported to the different organizations so that they can trend what is going on in an environment. Later on, you will learn about what labs must be reported to, like the CDC. You will learn about how to look at epidemiology through apps such as Bugs for Drugs that will tell you what antibiotics are not effective to what microbes in your area. This will help you in knowing which antibiotics you may not want to prescribe for a patient because in that area, maybe there's a lot of resistance going on. As a clinician, remember the goal of epidemiological studies is to discover and evaluate the trends of illness or disease in a group of people to determine a cause and effect and thereby prevent further disease. So as you as a clinician begins to read up on different disease processes or epidemiological studies in your area, it's important to utilize that information to guide some of the practice that you will do when you're in a certain area. Let's talk about the practical use of epidemiology. When susceptible populations are studied for the presence of a particular infection or disease, distribution patterns and symptoms may begin to emerge. I want you to think about the COVID-19. When COVID-19 occurred, how the epidemiologists would try to trend which areas were being impacted. And being able to identify those areas helped to target and develop programs, prevention strategies that aim to promote health and wellness to the most vulnerable populations for COVID-19. So that's just a real-time practical application of epidemiology. The same has occurred when it comes down to the flu shots, when it comes down to things like the rotavirus, when it's come down to other viruses that may emerge or other diseases. They did the same thing when it came down to HIV, when HIV was first diagnosed, and they were trying to find out where did HIV come from, what populations were being impacted. So those are examples of practical application of epidemiology and how it can direct how we practice as clinicians. These next few slides are just some terminology that is good to know related to epidemiology. So take a minute, stop the slide, read these terms and definitions, and get an understanding of the difference between sporadic, endemic, pandemic, prevalence rates, mortality, morbidity, and incidence rates. It's important to understand the differences between these terminologies because as you're reading the literature and as you're beginning to learn as a new clinician how to practice and best serve your population, you will see this terminology used, and it will help guide you at what you may want to do or not do in your particular area, how you can apply this knowledge. I hope this brief lecture was informative for you. The references are here for you. As you finish listening to this lecture, take the time to go back to your textbook and really spend some time understanding this content related to health promotion because it's a key aspect of what we do as advanced practice clinicians.